Surgery isn't the most thrilling thing to hear from your doctor, as we tend to think hospital stays, long recovery, and even pain. But today, there are minimally invasive surgeries being performed, and the University Health Partners of Hawaii and the John A. Burns School of Medicine are leaders in this practice.
The surgery department for University Health Partners of Hawaii actually is a faculty practice in surgery for the medical school. And we do all kinds of general surgery. We do GI surgery, endocrine surgery, which is thyroid and parathyroid. One of the big areas of focus for us is minimally invasive surgery. Back in the early 90s, general surgeons got a hold of minimally invasive surgery, which is actually laparoscopic surgery for all intents and purposes. We do it through small incisions, anywhere from a few millimeters up to 1 or 1.5 centimeters. We use small instruments and we do all kinds of surgery. So if you had your gallbladder taken out in the 1980s, it would have been through a big incision. Now we take it out through 3 or 4 small incisions, and the recovery time shorter. People actually go home the same day now when they have their gallbladder taken out if it's uneventful. And so it's really doing the same operations through small incisions with better, quicker recovery and better cosmetic outcomes really for patients as well. People are always anxious about surgery. It's the rare person who says, oh yeah, I want to have surgery. We understand that our job is to make sure we provide the highest quality care, and part of that is making sure we stay on the cutting edge of what's available to improve outcomes, patient safety, and also do it in the least invasive way possible. So our group is really focused on trying to make sure that we stay abreast of all the latest developments. It's constantly changing. That's one of the really exciting things about surgery. It's just when you think you're up to speed, something new comes along. The robot's one of those tools now that nobody really knows out there what's the role of the robot. It's really an advanced tool, a computerized tool that helps us do surgery. Some of the things we couldn't do before that we can do now through laparoscopic or minimally invasive approaches as well. Our first job is to make sure we take the best care of them that we can, and if it means we can do it through minimally invasive approaches, great. If it means we have to do it through a bigger incision because it's a safer way to do it with a better outcome, then we'll do that as well. The faculty practice actually has clinical offices in surgery at Queens in the Physician Office Building 2 or POB2. We have an office at Kuakini where we have 5 surgeons as well. And now we just opened a new office at Queens West Oahu campus in Ewa Beach. So we will have full service in general surgery at all 3 sites. We encourage people to work through their primary care physician, but if they're struggling getting a referral or they're not sure whether they even need to see a surgery, call us. We're always happy to talk to them. We're always happy to try and guide them through the sometimes complex healthcare system.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.
Oftentimes, women and mothers are so busy taking care of others, they forget to take care of themselves. But the folks here at University Health Partners and John A. Burns School of Medicine want to help you start the new year off right with good health.
Our office here at Palimomi opened about a little over a year ago, and we wanted to bring a wide breadth of all women's services out to Aiea. We have the ability to take care of people with GYN oncology problems or GYN cancers, infertility, incontinence, and the broad range of any GYN issues in this office. Hi, I'm Dr. Richard McCartin. I'm an OB/GYN with University Health Partners, and I'm a professor at JABSOM. I became an OB/GYN because it was something I found through medical school and through my rotations that it was the most interesting thing. My father's also an OB/GYN, so I at least had a little bit of background to that. It's ever changing. I do something different every day, and that's what's really great about my job. Well, here in Hawaii, I think that there's a lot of medical issues that have to be looked at, and women's health is our area of expertise. If somebody needed routine annual exams, mammograms, pap smears, we also take care of low and high risk pregnancies, OB ultrasound. Well, across the board, the most common things we see are people that come in that are pregnant, that weren't expecting to become pregnant, so it can be a very anxiety-producing time. So it's a chance for us to get together and kind of go over what the plan is, make sure that the pregnancy is healthy. Other things we deal with is people having a lot of problems with their periods. Pelvic pain is also a very common thing we deal with, and there's so many different reasons why people might have pain, so sometimes it can be difficult to come down to a real diagnosis. The John A. Burns School of Medicine has a faculty practice which is called University Health Partners, and we help to support the school as they bring us people to train. We have offices in all of the hospitals, both at Polymoni, Kapiolani, and Queens Medical Center, as well as we cover a lot of outlying clinics all over the island of Oahu, and now we recently opened an office in Hilo, where we'll be doing women's health. As a professor, what it does is it gives me the ability to work with residents and medical students to train them in the most up-to-date techniques and the most up-to-date knowledge that we have to take care of women in Hawaii. Technology and knowledge has grown so much in the past several years because we're doing more research to really figure out what's going on in women's health, and we want to make sure that we're using the most up-to-date knowledge we have. With the new year, it's always a good idea to come in and make appointments with the doctors. We're all awful at following up with our doctors. I'm the same way, but it's a good idea at the beginning of the year, as long as you're fixing all those things, to get in to see your doctor. If somebody wanted to make an appointment, they could just call us here at 808-671-0090 for the Polymoni office, or visit us online at uhphawaii.org.
This segment is sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.